Hi, my name is Autumn Smith. This is my head to toe, and here's my rubric. Hello.
Hello.
My name is Autumn. I'm a nursing student from SVSU. I'm going to be performing a head to toe assessment on you today, okay?
Okay.
Can you tell me your name and your date of birth?
Ryan Schertzberg, May 21st, 2004.
Okay, and what year is it?
2024.
Okay, and where are we?
Your house, Midlands.
Okay. All right, so you are A&O times 3, so I feel comfortable moving forward with this assessment. So some questions for you. Any allergies?
Nope.
No. Any current or past medical diagnoses?
No.
No. Ever had any surgeries before?
No.
Okay. Do you smoke, including vaping and marijuana?
Nope.
No. How about drinking alcohol?
No.
No. What would you say your diet and exercise are like?
I eat a pretty balanced diet, lots of fruits and vegetables, and I exercise like 3 times a week.
Okay. And how about any medications, including over-the-counter or supplements?
None.
No. Any significant family history, diabetes, anything like that?
Nope.
No? Okay, good. Moving forward, I want to take your vitals. So, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, rate your pain for me today.
I have none.
None.
0.
Good. Okay. I'm going to go ahead and grab your blood pressure now. Just going to feel for your brachial pulse here. Do you know what your blood pressure normally runs about?
Sometimes it's a little low, but normally regular.
Okay. Is there any reason I can't use this arm to take your blood pressure?
Nope.
Okay, perfect. And then make sure your legs are uncrossed for me, please. Okay. Got 106 over 80. Does that sound about normal for you? Yeah, perfect. All right. Now I'm going to grab your pulse. Okay, so your pulse was 78 and your respirations were 14. So I don't have a pulse ox, so I'm just going to take a look at your hands here. I don't notice any clubbing, which is good. I'm going to check a capillary refill, and I want it to be less than 3 seconds, which it is. I also don't have a thermometer, but have you had any fevers lately?
Nope.
No, I'm just going to check your skin temperature here, and that feels normal. Now I'm just going to go ahead and do some range of motion with you. First, can you just shrug your shoulders a couple times for me, please? Okay, good. So cranial nerve number 11 is intact. Do you know how to swim?
I do.
Okay, so I want you to do a swimming motion for me, please. All right, feel some cracking, any pain there?
No.
No, can you do that backwards for me, please? Is that any pain with that?
No.
No, okay. All right, go ahead and bring your arms or hands out like this for me. Okay, push me away. Good. Push me in. Good. And then go like this for me. Push me up. Good. And then push me down. Good. So strength and range of motion is intact there. I'm just going to feel your muscle tone and your temperature here. Notice a couple freckles. Is that normal for you?
Yep.
Okay. Tone and temperature feel great on that side. Also noticing some freckles. Nothing that's out of the ordinary. Tone and temperature feel good. And now I'm going to feel your brachial pulses for symmetry here. All right, and those feel strong and even on both sides. Moving to your radial. And those also feel strong and even on both sides. And now I'm going to feel your carotid one at a time. Okay. And those also feel strong and even. Now I'm going to listen for bruits. Okay. So if I heard a bruit, it's going to sound like a whooshing noise, and it's going to tell me if you have an obstruction or aneurysm. Any family history of aneurysms that you're aware of?
Nope.
No? Okay. I'm going to listen with my bell, and I'm going to have you hold your breath for me. Okay. No bruits noted there. You can breathe. And then I'm going to have you hold your breath again for me. Good. And then no bruits noted there. All right. Looking at your face here, it looks symmetrical. I don't see any issues. And then I'm going to go ahead and look through your hair. Thank you for taking it out for me.
It's going to be a mess. Just ignore that.
Oh, no problem. All right. Looking for any lesions or abnormalities here. Okay. Now I'm going to go through and feel all of your lymph nodes, starting with your occipital. Okay. About right here. Non-palpable. I'm just going to move your hair back here. If you want to put it back up, you can. All right. So feeling your pre-auricular, non-palpable, your post-auricular, non-palpable, your cervical chain, non-palpable, submandibular, non-palpable, then submental, non-palpable. And then do we mind if I take your gown down a little bit? I'm gonna feel your supraclavicular, it's also non-palpable, and I'm gonna check your skin turgor here. Non-tenting, which is good. If it was, I would be concerned of dehydration, so that's good. So I'm gonna check your frontal and maxillary sinuses. Do you ever have like seasonal allergies? No.
Sometimes, but nothing super bad.
Okay, do your sinuses seem to hurt around those times?
A little bit.
Yeah, okay, so I'm gonna go ahead and palpate here. Do you feel any pain?
Nope.
No? Okay, so this is your frontal, and then going to your maxillary. Any pain?
Nope.
No? Good. Okay, so we don't have a smelling chart, so we're not going to do cranial nerve number 2, but do you wear contacts or glasses?
I do.
You do? Okay, which one do you wear?
I wear both. Depends on the day.
Wear both. Okay, do you have any issues with those, or they seem to be working for you?
Nope. Go to the eye doctor every year. We're good.
Every year? Okay, good. Notice any drainage of your eyes at all?
No.
No? Okay, good. I'm just gonna go ahead and look in your eyes here. So you're okay, and I'm gonna look here. Okay, sclera looks white, everything looks good. Any sensitivities to light I should be aware of?
Nope.
No? Okay, go ahead and just look straight ahead for me. I'm gonna shine a light in your eye. Good. And then now I'm going to shine the light at the tip of your nose, and I want to see the reflection in the same spot. Which I do. Good. And then go ahead and look at my pen light, please. Look at my hand. Pen light. Hand. Good. And then go ahead and follow my pen with your eyes and your eyes only, please. Good. So cranial nerves 3, 4, and 6 are intact. Your eyes are parallel, which means your pupils are equal, round, and reactive to light and accommodating, which is good. Now we're going to test your cerebellar function. So go ahead and touch your nose for me. Pen light, nose, pen light, nose, pen light, nose, pen light. Good. All right, go ahead and make an okay sign for me, and then alternate your fingers to your thumb. Do that as fast as you can. Good. And then go ahead and put your hand on your lap and flip it. Good. All right. Cerebellar function is intact. Moving to your nose, have you ever broken your nose?
Nope.
No. Are you congested right now? Anything that would alter your sense of smell?
No.
No. Okay. Can you just plug a nostril and sniff for me and do it to the other side? Good. And then go ahead and look up for me, please. I'm just going to take a look. All right. So I see even hair distribution. I don't see any polyps or deviated septum, which is good. Now we're going to test cranial nerve number 1. So go ahead and close your eyes for me, please. And I want you to tell me what you smell.
Coffee.
Good. Cranial nerve number 1 is intact. I'm just going to go ahead and feel your ears here. Any pain or anything?
Nope.
No? Okay. I don't have an otoscope, but I'm just going to go ahead and take a look. Okay, I see earwax, which is normal. I don't see any foreign objects. Which is good. Going to come over and look on this side. Also see earwax, which is normal. Don't see any lesions or foreign objects, which is good. Okay, moving on to your mouth. Have you ever had your tonsils taken out?
Nope.
No. Any difficulties swallowing?
Nope.
No. Okay. So, I'm just gonna have you stick out your tongue for me. Say ah. All right. Uvula goes up on phonation, which is good. I'm just gonna look in your mouth, look for any lesions or abnormalities. Go ahead and put your tongue to the roof of your mouth, please. Okay, good. So your mucous membranes are moist. I don't see any abnormalities there, which is good. Looking at your trachea, it looks aligned. It doesn't look deviated. Can you swallow for me? Okay, good. And then can you stick out your tongue and move it side to side and up and down? Okay, good. So cranial nerves number 9, 10, and 12 are intact. Now I want you to clench your jaw for me. Unclench, clench, unclench. Good. And then close your eyes, and I want you to tell me where you feel sensation, okay?
Okay. Forehead, nose, left cheek, chin, right cheek.
Good. And then go ahead and raise your eyebrows up for me. Good. Smile, frown, puff out your cheeks. Good. So cranial nerves number 5 and 7 are intact as well. And then we will check cranial nerve number 8 at the end with your Romberg test.
Okay.
Before we move on to the back, I am just going to look at my rubric here quick. All right, so go ahead and turn so your back is facing towards me, please. All right, first thing I'm gonna do is I'm just gonna check your thyroid placement here. And I'm not choking you. So I'm just gonna displace a little bit and feel. Okay, until the other side. All right, and it feels good to me. Just feeling your back here, muscle tone and temperature feels good. I'm sorry. No, I see some freckles here. Looks is that normal for you?
Yep.
Okay. And then I'm gonna check your lung expansion here. So just go ahead and take a deep breath for me. Okay, good, and that feels even. And now I'm going to listen to your lungs in 12 spots. So every time you feel the stethoscope, just go ahead and breathe for me, okay? Take a deep breath. Can you bring your shoulders back just for a minute, please? Okay. All right, go ahead and relax. All right. One. 2, 3, 4, 5, 6. Do you need a break?
Nope.
Okay. 7, 8. I'm just going to pull your bra down a little bit. 9, 10. I'm just going to come up under here. 11, 12. All right. So your lungs sound clear, no crackles or wheezes, which is good. I now am going to percuss in those same spots, so just go ahead and breathe normally, okay? Just gonna feel some tapping. And then I want to hear resonance with this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. All right, and I hear resonance, which is good. Now you can go ahead and lay down. First, I'm going to move these pillows, okay? I'm going to check for JVD. So if I saw that, I'd be concerned of fluid overload. Go ahead and look to the right and look back towards me. I don't see any, which is good. If I did, I would put the head up to 45 degrees to see if that went away.
Okay.
Now, do you mind if we pull your gown down for me, please? Good. All right, now I'm going to listen to your heart. This is my patient's right side, and this is their left side. I'm going to start with the aortic valve, and then I'm going to listen for murmurs with the bell here. So, clavicle, space, first rib, space, second rib, space. Lub dub. And then no murmurs noted. Moving on to the left side to the pulmonic valve, clavicle, space, first rib, space, second rib, space. Lub dub. And no murmurs noted. Moving to Erb's point, this should be the largest heartbeat. This would be the third intercostal space, so third rib, third space. Lub dub noted and no murmur noted. Now I'm going to go to the tricuspid. So fourth rib, fourth space. Lub dub. no murmur. Now moving on to the mitral. So 5th rib, 5th intercostal space, and then we're going to move mid-clavicular. Just going to lift up your brow a little bit, okay?
Mm-hmm.
And then I'm going to listen to your apical pulse here for a full minute. This is your body's most accurate heartbeat. All right, I got 62, which is close to what I got earlier. Okay, and now I'm going to listen for a murmur on this side. And then no murmurs noted there. So your heart sounds normal, which is good. So we can go ahead and pull this up, and then I'm gonna lift it up there. There we go. Okay. I'm gonna come to the bottom of the bed, look at your stomach. I don't see any masses or lumps, which is good. I see you have a piercing there. When did you get that?
3 years ago?
Okay. Any issues with healing?
Nope.
No. How about with that tattoo?
No problems.
No. Okay, good. And now I'm gonna listen to your bowel, starting in the right lower quadrant. Okay, 3 to 5 gurgles noted. Moving to the right upper quadrant. 3 to 5 gurgles noted. Moving to the left upper quadrant. 3 to 5 gurgles noted. Moving to the right lower quadrant. And 3 to 5 gurgles noted there as well. And now I'm going to listen to your arteries for bruits, starting with the aortic. So we're going to find your xiphoid process in your belly button. It's about right here. Listening with my bell. No bruits noted. Moving to the right renal. No bruits noted. Moving to the left renal. No bruits noted. Moving to the left iliac. And no bruits noted. Moving to the right iliac. All right. Don't hear any bruits, which is good. And now I'm going to percuss. You're just going to feel some tapping, and I want to hear timpani with this. Okay, and I hear timpani, which is good. I know I'm going to try to find your liver border. And this is going to sound dull when I find it. Sounds pretty dull right here, so I'd say your liver border is about right here. I now am going to palpate. I'm going to start by starting lighter and going a little bit deeper. Let me know if you have any pain, okay?
Okay.
I'm also going to watch your face for any grimacing. Any pain?
Nope.
No? Okay, gonna go a little deeper. Any pain there?
Nope.
Okay, good. Abdominal assessment looks good. I now am going to feel your femoral pulses, and I'm gonna listen for bruits there as well, okay?
Okay.
So I'm just gonna feel in here, and I'm just gonna make sure they feel symmetrical. Which they do. I'm gonna listen for bruise. Don't hear any bruise there. I don't hear any bruise there, which is good. Moving down to your legs, just gonna feel for muscle tone and temperature. Feels good. I see you got a tattoo here. When did you get that?
2 years ago.
2 years ago. Any issues with healing?
Nope.
No? Okay, good. Just gonna feel here. Temperature, muscle tone feel good. I don't see any abnormalities. I'm just gonna take off your socks.
Okay.
Oops, I'm sorry.
You're good.
All right, I'm gonna check your capillary refill. Less than 3 seconds, and just looking at your toes. Okay, looks good. Can you go ahead and bend up your knees a little bit for me, please? I'm gonna feel for your popliteal pulses here. And those feel strong and even on both sides. Moving to your posterior tibialis. Those also feel strong and even on both sides. And then your dorsalis pedis. Those also feel strong and even on both sides. Now I'm going to go ahead and have you close your eyes.
Okay.
This is sharp,
Mm-hmm.
and this is dull.
Okay.
And then just go ahead and tell me where you feel sensation and if it feels sharp or dull to you, okay?
Mm-hmm. Sharp right thigh. Sharp right shin. Dull left shin. Sharp left thigh. Dull left foot. Dull right foot.
Okay. Good. Now I'm going to go ahead and have you sit on the side of the bed. Have to get your socks back on here. Okay, I'm going to check your reflexes here first real quick. There we go. Good. I'm just going to check some range of motion strength with your feet first. So could you just kick up your legs for me? Any pain with that?
Nope.
Can you go like this with your ankles? Any pain with that?
Mm-mm.
No? Go ahead and press down on my hands. Okay. Up. Good. Out. Good. In. Good. All right. Strength and range of motion look good, so I feel comfortable getting you up. So we'll go ahead and get your shoes on here. We're going to test cranial nerve number 8 and do the Romberg test.
Okay. Am I good to stand?
You are. Yes. All right. So I'll have you close your eyes, and I'm going to stand here and see if you sway. All right, and no swing. So you have a negative Romberg test. I feel comfortable walking with you now. So let's go ahead and walk to the door just normally. Good, and heel to toe back, please. Okay, good. All right, so based off what you told me about your diet and based off your assessment, I would give you a Braden score of 23. I am not concerned that you would get a pressure ulcer.